at least for another hour. I don't have to talk about the budget or the record of decision or any of that stuff. And frankly, feel just a little bit bad about talking about the hot dogs for the last 10, 15 minutes of the last hour, because I know that there's some people that may consider hot dogs to be less than a superior form of diet.
I thought we always talked about bratwurst. When did you switch to hot dogs?
I like brats too. No, there was I don't know. Today is Wiener Schnitzel Day. It's if you're looking for something to celebrate, it's Wiener Schnitzel Day, and it occurs to me that I'm mentioning that while I've got a guy in front of me named Klaus Meinhof, and probably had some schnitzel in his life before.
Yes.
Welcome to Guam, Doc. Good to have you.
Thank you.
So, a pulmonologist, and if I understand the different ologist parts of the human body, you're generally concerned with how people breathe and the exchange of oxygen in the air, and being able to take those oxygen and attach it to the mitochondria, and then it goes out into all of the muscles, and maintaining healthy connections between that and the lungs.
Yes.
So, tell me a little bit about how you got into this. He's not a big talker. I'm just going to tell you that right now. But he's talked enough so I can detect a little bit of a German accent, an accent from around that part of the world. Are you originally from there?
Yeah, that's right.
So, how'd you get to the United States?
Very straightforward, through New York City.
Well, but tell me about the medical journey that you were on. How did that get started?
Yeah, so it's pretty simple. I grew up in a village in southern Germany as the son of a doctor, who's also the son of a doctor, who was also a son of a doctor. So it was kind of
no pressure.
Fourth generation. And I always resisted that for about 18 years. Mm-hmm. And when I finally finished puberty, I accepted that doctors are kind of doing useful stuff, and I decided to go to medical school.
Might be some value.
Yes. I was always happy with that decision, but I had no idea about the lungs, quite frankly. That was not my goal. I just wanted to be a doctor, primary care more than anything else, really, because that's what I knew.
So in all the interviews I do with doctors, I always find it kind of interesting to, especially when we start delving into what was it that led you to your specialty. When did you get that light bulb moment?
It's a bit complicated, but I'll make it short. So when I was young, I had two cousins in the U.S. We visited them, so America was always kind of there for me, like as a great destination and a great country. And then when I went through med school, we started, complaining about some things, and we're like, oh, America is so great, let's go to America. So a couple of people out of my 400 classmates took the USMLE, the American exam. And I was lucky enough to match into internal medicine residency in the Bronx in New York. So that's how I came to New York.
Is this Elmhurst?
No, not yet. This is Elmhurst is Queens.
Okay, so I
told you it's complicated.
It's okay. Well, I got to mention Elmhurst because I read it in your bio and mentioned it in the last hour. And one of my friends, Charlie Hermosa, reports being born at Elmhurst.
Oh, that's amazing.
Yeah,
that's
amazing. Always, the connections. The world becomes even smaller as you get to Guam because everybody's got a connection of one kind or another. But you get to New York, and then.
There's actually a Guam connection already, but I didn't know about it at the time. I had a co-resident 1 year below me, Priya Kodiamplakal. Her family is still here. Mm-hmm. Some people are still here, connected to University of Guam.
Interesting.
She actually was my med school residency, colleague. I only found that out years later, but I already had a connection to Guam at the time. Excellent. Then, as I'm going through residency, it's 3 years for internal medicine. That was the easy part, but then you've got all these different specialties, all these different organs. I had no clue really what to do. I wasn't that person who grew up when I was 4 years old and knew they want to be a cardiologist. So I just really liked the ICU. When I first came to the ICU, I was like, oh my God, this is interesting. There's machines everywhere. It's beeping all over the place.
Uh-huh.
I was a little intimidated.
Right out of a Monty Python movie.
It does, yeah.
Beeping machines.
Yes. Yeah, sometimes it's a bit like that. So then I was like, okay, critical care, that's really interesting. It's a lot of physics, mechanics, that's cool. And then eventually I realized, okay, pulmonary is attached to that. It's pulmonary critical care in America.
Right.
Not in Germany, by the way. But, and so I chose that, although it was kind of last minute. I was thinking about just doing critical care. A couple of people talked to me you're an idiot. You need to do pulmonary critical care, so you're a little more versatile. You find more jobs outside New York City. And that was very good that I got that advice. So then I ended up at Mount Sinai in Manhattan for another 3 years, and that was my pulmonary training.
A vast number of steps to get you from there to here.
Yeah.
And as I said, one of the impressive things was, and I don't know how easily they hand out titles in the medical game, but to be named as an associate program director for the Division of Pulmonary and Critical Care at Elmhurst, also assistant professor at the Icahn School of Medicine at Mount Sinai. A couple of well-known names in the hospital game, not hospitality game. A couple of well-known names there, and it looks like you have managed to achieve great levels of achievement there.
I mean, I think there are many people who do similar things at my stage. I mean, I've been doing this for many years. Just very quickly, the Elmhurst thing was actually I already went to Elmhurst as a trainee and really liked it because it was so diverse. There were people from all over the world, and there was a lot of interesting diseases that you wouldn't necessarily see in like Long Island or like Westchester, like somewhere in the suburbs.
The doctor says interesting diseases. I always think of flesh-eating bacteria and things like that.
They have that everywhere.
But we've got certain things around here as well. I mean, how long have you been on Guam?
So total like 4 months, but we only moved here like late June.
Okay, so have you had a chance to meet a lot of patients that are presenting with some interesting diseases that you haven't seen yet?
Yes. No, it's very interesting, and of course, interesting is a bad word in medicine. Yes, I fully realize that. But yeah, it's different. It's different here, and that's one of the reasons why I'm here, because we get to see patients that would otherwise not be treated in a hospital of this size. We do everything here, so that's a good challenge.
Well, among the things that I like most about Guam Regional Medical City, you talk about diversity, but there's a diversity of specialists that are there as well, and I think there's a number of other departments that you've got at Guam Regional Medical City that will interface very, very well with you once we've got a better handle on what it is that the patient is coming in and presenting, and then we can figure out what the therapy is and how we're going to end up fixing them. It's not always, and especially I think in terms of pulmonology, not necessarily cut and dry. I'm wondering how many moms and dads out there think their children are asthmatic, but as it turns out, probably are just suffering from allergies.
Yeah, that's a very common combination, quite frankly. People often have allergies and asthma. I do have to say I'm not a pediatric specialist, so kids scare me. But I know we have...
Use the baby needle all the time. Just the baby needle, that's all. That's all.
Right.
That's what I was telling them when I got the stress test, and they wanted to poke me someplace where they could inject all this stuff. I said, you come at me with an adult needle, it's going to hurt. Just go in with the baby needle, and I'll be able to get everything that I need. But so I'm, I wanted to approach this. It is the Ray Gibson Show, it says on a thing, and so I wanted to come at you with things that I think are interesting and important to me. So you're a swimmer. We're both athletes.
Not a very good swimmer yet.
I'm not a very good swimmer
either.
Here. But I'm a runner as well. And so runners obsess, as you know, about every little thing. And there used to be, if you wanted to know what your VO2 max was, you had to go and pull out a chunk of muscle. Now the Garmin folks have made it easy. It's part of the sensor. You have it too, right?
Brand, yes.
So yes. So I'm going to ask you the question, Doctor. So I've got the Garmin. I think this is a 265 or something like that.
Yeah.
They are expensive watches, jeez. But it's worth it. I equate it to a Tamagotchi, that old Japanese toy.
I'm old enough to remember.
You're old enough to remember the Tamagotchi, except so this is the control, and I don't have a Tamagotchi. I'm the Tamagotchi. I use the Garmin to help keep me alive. Give me some of those metrics. Anyway, so my VO2, according to Garmin, is 45, which is actually pretty good for a 63-year-old guy, right? But as usual, as I say, runners, we obsess over everything. I want more. I want to go from excellent to whatever it comes after that. I want to be in the top 5% in terms of 63-year-old white guys. As a pulmonology doctor, how do I get there? What are some of the things that I could do besides high intensity drills? Is there a pill I can take?
I hate to disappoint you, but your lungs are usually not the limiting factor. However, we're very happy to do pulmonary function tests and make sure that your lungs are not the limiting factor. But for most people, the lungs I wish I could be more important, and like I feel that the lungs are underrated greatly and unjustly. But for athletes, it's usually not the lungs that are limiting.
But that's where the power comes from, isn't it? I mean, they can't run without oxygen. I mean, that's our fats and glycogens aren't the only fuel that we've got. We've got to breathe as we're running. So
yes, I will say, of course, as you are training, your lungs train with you, and there are people who have horrible lungs, at COPD, asthma, like more smokers, and if they do like physical exercise and they will get short of breath doing that, and it will be uncomfortable, they will be able to do more with less. And it's also the muscles learn how to deal with that, and the muscles obviously also needed for breathing, right? It's not just to walk. We also have muscles between our ribs that help us like lift our whole rib cage. And those can be trained, and your diaphragm can be trained. So yes, I'm not a sports medicine expert.
It's okay.
I will say, I would go with the general recommendation that you do have to do a lot of aerobic training to get that most efficient. And you see the triathletes, the really good ones, they have pretty big lungs.
Large cages, if you will.
Yes,
large cages, I see that. And zero body fat, which is the other thing, a little bit trickier to get
19%.
to. 19's, that's not bad as a crow flies,
Not
but
good
you get
for
these
a
guys.
triathlete.
That's right. You get these guys and they're down 8 and 9% body fat. And you go, what is it that you guys live on?
I mean, that's when you optimize for a triathlon. I think if you get through a big famine, then you probably want to have more than 8%. So it all depends.
It's ridiculous conversations. But again, you get athletes in the room. Those are some of the things that we talk about. You mentioned a pulmonology function test. Now, I think I might have had one of these at Medical City in the Philippines a couple of years ago. They put me in like a little phone booth, and the guy has me breathe in and breathe out, and then we connected up to a machine. I didn't really understand what it was that we were trying to do. So naturally, I think I failed that test miserably. I did not get good numbers. And in fact, they wanted to prescribe some kind of breathing thing for me and were concerns that maybe I had the beginnings of COPD. Now, I don't know too much about all of that. And it wasn't, it could have been explained a little bit more clearly. But after I saw the price for the drug, I'm like, I think I'll be all right. But from my background, 60 pack year smoker. I was a 2-pack-a-day smoker for about 30 years. I quit about 20 years ago, maybe a little bit more. I just recently took a spot mass test, and they did not find any indication of any cancerous DNA in my lungs.
You're ahead of the game there.
Yeah, followed it up with a low-dose CT scan, and again, found no indications of any issues related to my prior years as a smoker. But you've got new stuff now, right? You got a new thing? You got a new toy over at GRMC?
I'm only aware of our PFTs and screening. I'm not sure if we're referring to
a new device. I think we're talking about the body box. That is the pulmonary. And it sounds similar to what you're talking about, what you had in the Philippines, pulmonary function test, PFT. And then you hook up to a cycloergometer, right? And then
that's an exercise test, which can also be added to
an exercise.
Okay,
a cycloergometer.
Okay, that's
okay. And so this is where that little thing we talked about before the show started. Dr. Meinhof, I told him we're going to get Ray in there. We're going to get him updated on his oxygen uptake using this PFT. And he said, well, maybe I should compete with him. I said, well,
I want to do that.
What are your thoughts? How does this work?
I'm down.
So, maybe we need a baseline test, and then we could do a percent change improvement.
Yes.
You're a lot younger, right? So you have an advantage. So we got to have percent change improvement, maybe. And I don't know what the grand prize is, but
we have another German at GRMC.
I don't have to go to the hospital as a grand prize.
Get a calcium score or something.
I don't know. I'll be happy with lower LDLs, but that's I'm sorry, too much medical conversation. But it does sound like a unique way to be able to, as he says, we're going to help establish a baseline, and then we can move forward up and down from
athletes,
there.
That would definitely be.
But what about just regular plain old folks? There's a lot of people that we talked about this. I just walked up a flight of stairs, and all of a sudden I'm out of breath. Is that is there an issue there with my heart? Is there an issue there with my lungs? What's lurking back there? What do you?
Right. That's a very important point that I wanted to make sure we touched, and I'm glad you brought it up. Obviously, being short of breath can have many reasons. I think the main message people should get hopefully out of this is that if you're more short of breath than your peers, it's not just like, oh, I'm getting older. It's just I can't, like, it's normal. I'm 60. I can't run. That's fine. No, it's not normal, right? It shouldn't be like you're obviously like in a much better health, but many people just tend to accept the limitations and not look into it. And I think it's very easy to do pulmonary function tests. You've done the platinum version of all of that, and that's what I would do. But just doing the PFTs will find COPD, which is a very common condition, right, in smokers, and it's very easy to diagnose. And it can be easy to treat. It's not curable, right? But we can make it better. We can make symptoms better. People will be able to do more. And, just with some inhalers, there are different inhalers now. They are very expensive, like you mentioned.
Yeah.
But there are ways to, sometimes there are ways to get around that. And, of course, if you have insurance coverage.
What's the point of the inhaler?
So there are basically 3 types of inhalers. They're bronchodilators, and they can work in 2 different ways, like anticholinergics and beta agonists. That's just 2 different ways of opening up the airways. And then the third class is steroids, inhaled steroids.
Oh.
And so steroids, everybody's like, oh, yeah, steroids are not great to take generally if you take them by mouth, right? Either for bodybuilding or for prednisone for inflammation. Lots of side effects. But what I'm talking about is inhaled steroids. So those are very safe. They get inhaled into the lung and then pretty much get deactivated by the liver as soon as they get into the blood. So they don't affect the rest of the body.
Okay.
They only affect your lung. And if you have asthma, that's extremely important. That's a big problem with people who have asthma and maybe don't really know they have asthma, or they're just being treated by somebody who maybe doesn't know better, or they're using their grandmother's inhaler.
Yeah.
And asthma is an inflammatory disease, meaning you have a lot of inflammation in your lungs and you need steroids for that. And that's where the inhaled steroids come in. And it can make a huge difference. It can make a huge difference in people's
The breather
lives.
I'm most familiar with is albuterol.
Yeah, that's the patch, the Tylenol of asthma. You take that, you bring down a fever, you feel better, but it doesn't address the infection, right? You can still die of asthma. You're actually more likely to die of asthma if you take albuterol all the time and nothing else. That is actually
because you're not
worse.
taking care of the inflammation, what's causing the inflammation. You're just covering it up.
Just like you're popping Tylenol for the sepsis that you're having. So that's very bad. That's actually, I've come across these patients not just in Guam, everywhere. I've practiced in Maine and in New York, of course, for quite some time. And there are always still patients who are like, oh yeah, I'm just taking the albuterol, feel better after it.
Yeah,
it's great. And there are people who die of asthma every year.
What's the underlying condition that you're masking?
Yeah, that's the inflammation with with these really inflamed airways. And if you get into a really bad asthma exacerbation, it may be too late for the albuterol to bail you out.
Wow, you want to talk
that's
about
one big
killers,
message. Yeah, it's few people, of course. It's very few people. It's a few hundred, but it's still a few hundred a year.
Well, the reason why I ask about albuterol in particular, I have never done it, but I know people that before a race will pop some albuterol. Will take a hit off of the breather here, and they believe that it is accountable for shaving off seconds off of their times.
Yeah. So. I mean, it's pretty...
Is there science behind that?
There is science to the degree that there is exercise-induced asthma, right? So some of these people probably have exercise-induced asthma. Maybe they're very mild. Maybe they're not quite meeting the criteria, so subclinical, but they do have a little bit of a touch of exercise-induced asthma. So when they exercise, their airways constrict a little bit. They should be opening. That would be the natural thing. The airways should be opening up when you exercise. And maybe if they do have that, then it'll help. If you're healthy, then, in the Olympics, of course, I guess it's outlawed too, but I don't see many people doing albuterol before.
Yeah, I don't know, because you can say, I need this for my medication because I'm asthmatic, and then pop that just before the race. Klaus Meinhof, that's Dr. Klaus Meinhof, a pulmonologist intensivist is the title that they've given him at Guam Regional Medical City. Again, one of a number of specialties that they continue to expand on. Eric Plinsky in the studio also to plug the get-together that we're going to be having over at the Micronesia Mall. You hear me with the most sincere sound in my voice saying, every breath counts. And so it's not all day. I mean, there's a limited number of hours that this is going to be happening over at the mall. So what's the deal?
Yeah, it's going to be not this coming Saturday, but a week from Saturday on September 20th at Micro Mall. This time it'll be from 10 a.m. till 12 noon. Dr. Meinhof and his counterpart, Bob, I forget his last name.
Yeah.
You got
it. Is it Salas or
Bob
Salas?
Salas. He's our our tech that runs the PFT test. Former military guy, great guy. He's been with us, I think, the whole time we've been open. And he's so busy doing these tests, he's had to start coming in on Saturdays himself just to keep up with the demand. But we're going to be doing a free event for the public to learn all about breathing, how you can avoid getting yourself in trouble, and if you have breathing issues, how Dr. Meinhof can help you out. So it'll be, the only difference is it won't be at the center court. We usually always at center court, and that's fully occupied. I don't know if they have a mall ball activity or something
Last
going
week it was
on.
a chess tournament.
There's always something going on at the center court. So we're in the former JP Superstore area. I guess it's across from Island ePro. So a little bit, it's right off the center court.
Folks will be able to
so,
find it because this is important enough, and the time is limited enough. So it's going to be one of those things. Get there as soon as they open the door. Start walking around, swing by beyond the box, and see what they've got for sale, and then go and check out what they're going to be up to with the doctors and the technologists that are going to be walking you through some of these things. Now, I got a zillion questions because breathing is important. And you got the two lungs. Everybody knows smoking is bad, and you shouldn't smoke, and you shouldn't vape. I don't know how deep I want to get into the vaping conversation. I'm not a doctor. I know some people that have taken to vaping, and they claim that it helped them stop smoking. The only problem is a lot of the times you just stay on the vape. Okay, I'm not smoking. I'm not smoking a cigarette now, but I'm taking the vape, and there's nothing wrong with vape, so I'll live forever, and I'll be able to beat Ray in races and all of that stuff. What's the current conventional wisdom on patients that vape?
Yeah. So the easy answer is, don't light anything up and breathe it into your lungs. Don't do that. Vaping, it's not always combustion. I get that. It's sometimes just nicotine. It's still, nicotine is quite, it's very addictive. Well,
you got to heat something up so that there's a vehicle to inhale.
To make it into a vapor, basically. So if I knew that a given patient is never going to quit smoking, and they exist, right? There are some people who pretty much would bet money that they're just not going to quit. And I could pick between vaping and smoking cigarettes, then I would pick vaping. But generally, vaping has big problems because it's not regulated well, right? This is a huge blunder by our politicians many years ago, predates both the Biden and the Trump administration, that this was not regulated by the FDA. It should have been. Vaping should have been regulated. It wasn't, and so you buy something, it comes from abroad often, you don't know how much nicotine you're getting. It's really like you're going to Starbucks and you're buying like a gallon of coffee, but you don't see that's a gallon. And so people get used to very high nicotine doses, get super addicted, and of course the worst is that flavored vapes, and it's just ridiculous. It's a crime. So it's very bad to vape. It's just like if you know you're not going to quit smoking, fine. Then
that's how we're going to try
harm reduction
to see
in some select people.
But you also got to know, you got to be aware, like anything else. So all right, so don't buy the T-Move vape. Go someplace, and there's a big company out there somewhere. There's somebody renowned in their industry, and there are some people that that legitimately want you to help use that technology to help you cease smoking, cease the nicotine.
What drives me mad is that there was Nicotrol before there was Juul, right? There was a product available,
right,
with prescription that you could use to get rid of cigarettes, and that worked, and that was regulated. You knew how much nicotine you were getting, but then these two Juul people came. They're both billionaires, I believe, now. It's a very interesting story that we don't have time for, but they basically commercialized this to a massive degree and promoted it to kids. Right? That's the real crime. That's where they should go to hell. I'm not that religious, but they should go to hell.
I agree. We've had numerous debates here about the efficacies of using it as for smoking cessation and things like that. And my original thinking when it first came out all those years ago, when it became commercialized, I was actually in favor of it because I felt I was a smoker, and I know how hard it was to quit smoking.
They are very, absolutely. If you're a grown man or a grown woman and you make a conscious decision and you're like, I'm going to, and ideally you know how much nicotine you're getting, and maybe you're even tapering it off, that's great. That's like the methadone of tobacco, right? methadone has its role, but not for kids, right? I wouldn't sell it to
no
candy store.
bubblegum flavors, things like that. No, I totally get it, totally understand it. So it has its place. It had its place, but if for smoking cessation, it's not the only tool you can get.
The way I see people using it, they're driving and they're blowing like huge clouds. I do not think that's very well dosed.
I think it's a contest to try to make the cloud as big as possible. But as we say, there's other methods. Personally, the day I smoked my last cigarette was the second day that I decided I was a runner, because I knew I couldn't do both of them. However, not smoking and not taking nicotine are two totally different things.
Yes,
I was still craving the nicotine. I knew I wasn't going to go to smoke. They hadn't invented the vape yet, and so I went to Nicorette gum.
Of course.
Did
it's
that
been around
for
forever, and there's nothing wrong with of course, nicotine replacement is evidence-based. Is absolutely fine. Gums, patches, and even the vaping. Basically, if it's regulated, problem is it's not regulated, and it's all and then the
so you can't see yourself stepping down.
No, you're stepping up. Most people stepping up. I don't have numbers. I didn't. You didn't tell me you were going to talk about vape.
No, it's okay.
We could go on about that for hours.
Well, marijuana's next. I'm just going to prep you marijuana.
Awesome. Yeah.
So we go from one to the other.
Yeah.
But I appreciate it. For those of you that are listening that still smoke, I'm not going to give you a hard time about it. I know how tough it is to quit.
No, it's the hardest. It's harder to quit smoking than heroin.
Virtually everything out there, alcohol, and it took me a bunch of tries to get it, and even though I'd quit smoking, it took me about 2.5, maybe 3 years before I was able to get off nicotine completely. And I was on a trip in Okinawa, and I ran out of Nicorette, and I went to the store, and it was the one store in Japan that didn't have any kind of nicotine gum, and so I just bought a regular pack of gum, and that was it. I realized that day I was all done with it, and thank God. I still have a couple of vices. Morning radio is one of them. As I said, the next conversation goes to marijuana. To what degree is marijuana capable of creating those inflammatory moments in somebody's lungs that could lead to the next worst thing?
Yeah, that's a tricky question. I mean, marijuana is not as bad as tobacco. That's pretty clear. It's not thought to really cause lung cancer to any significant degree. But of course, anything you inhale, anything you burn and inhale will hurt your lungs and can cause emphysema. So it's not great to smoke marijuana every day, obviously. I'm
thinking of certain people, and you know who you are, but go on.
It's not as harmful as smoking cigarettes. I think it shares the problem with the vaping that the doses have just escalated so much. Right now you've got such higher grade marijuana, and there's just so much more THC in it, and it can't be good. I mean, I'm not a substance abuse, expert at all. For the lungs, if you want me to nail me down narrowly, lung health, it's not that bad. I would still rather eat cookies than smoke, weed. It's better.
Well,
it's better
the cookies with the marijuana in it?
Yes.
Okay.
Yes,
all right.
So I haven't done that in a long time, but I have tried. I have tried both, and I would favor the cookies.
You know what? And my story, and my friends that do smoke marijuana know, just go ahead and skip Ray, because he's not going to do this. And the reason why is I'm afraid, and as you say, as you point out, I'm born and raised on Guam, and I lived in Hawaii for a very short amount of time, and it was long enough to realize how much stronger marijuana was in Hawaii than it was with the homegrown stuff that we were getting here on Guam. Yeah. And then Hawaii was surpassed by Palau, and Palau managed to come up with a very, very strong strain of marijuana.
I tried to grow that in Germany. It didn't go well. But they've gotten better too.
Now that it's for all intents and purposes legalized in most of the Western countries, there are industries that are springing up, and I think we're getting to a point where even here, I think there's opportunities for craft marijuana growers here on Guam to be able to come up with something unique strains. My problem is I don't know what's in them. As you say, there's no way for me to test how much THC I'm getting.
Yeah, but if you're growing it, if it's actual plant, I mean, yes, the plants have also, I guess they've, I'm not knowledgeable enough about that. I think some of the plants have been, designed to really have very high THC content, and I think that's always a problem, right? The dose makes the poison. That was known 500 years ago. Still true, right? Still true. A little bit of marijuana, especially, for some people with chronic pain or cancer, obviously I would never, I would never bat an eye about marijuana there.
It helps you out. I guess the question is safe, and as you pointed out a couple of times, if you have to burn something in order to get ingested into your system, maybe we need to look for a better vehicle to be able to transmit the THCs, the nicotines into your system. And as you point out, we got cookies, there's gummies, there's candies, there's all kinds of things that people might be able to concoct. We've got the idea that there's ways that we can ingest things, cigarettes and marijuana joints and that kind of thing. But what about the environmental factors that are beyond our control? There's a neighbor that burns trash all the time, or somebody's asking, what about somebody that works at a barbecue joint and is constantly surrounded by smoke and all kinds of particulate in the air?
Yeah, we even had that in New York City with the halal carts, the
carts,
halal carts. Yeah. So yeah, that's a big problem. Air pollution is a huge problem, and not in Guam, thankfully, generally, except if you're really next to the barbecue. But yeah, there are more non-smokers with COPD worldwide than smokers, because there are a lot of people who can't afford cigarettes, right? In the world, in India, in China, there's a lot of people who just have indoor air pollution and outdoor air pollution now in the last 20 years that have COPD from that. So yeah, there's only one way. You just have to get away from the smoke. You have to mitigate that as much as possible. There is a role for air filters. In Guam, I don't think for most people that's necessary. In Guam, all you need is a dehumidifier. You don't really need that. Like, the air is very clean.
The air conditioner is your dehumidifier. But other filtration devices, I suppose, unless your asthma or your inflammatory conditions are really, really bad, maybe you should have something in the living room or the bedroom that will filter the air again for you.
Only if you live next to the PD power plant, or if you are have a neighbor who really constantly burns stuff. I mean, we went to these wildfires in New York last summer, I think, right? It feels like an eternity ago. There was this huge wildfire in North America, in Canada mostly, and we had really bad smog. And that, definitely hurt people.
This is an interesting conversation, because you don't sound like you're knee-jerking over what other people naturally will knee-jerk over. Say, oh, look, we got stuff in the sky. I said, bring the kids inside, get all the old people inside, and we'll go. It's pollution danger rating 10 or something like that. You seem very calm about it.
It's a nuanced. Air pollution is really interesting, and there's not a very straightforward answer. For example, New York has cleaner air than Europe, and most people never guess that. But it's really because there's not a lot of industry there, and it's in Guam, of course, is amazing in that regard.
Well, and conversely, I've been in Beijing and Peking. I went there once upon a time, and I remember flying in, going, "Wow, is it going to snow?" And they said, "No, it's May." I said, "What's all that stuff in there?" And they said, "Pollution." And it was. All the coal fires that they've got out there, and it might be industry that's causing it, but there's still a lot of people that live.
No, that's a
that's how we make
topic.
fires to cook food.
I was just in China this summer because my wife's from Shanghai, so there's been a huge change in the level of air pollution.
It's such a beautiful city.
Yeah, and even Beijing, which Shanghaiers don't like too much, but the air is so much cleaner now, and not just during the parade. They have made a huge progress when it comes to air pollution.
So what did they do?
I mean, it's in Shanghai. They just moved all the polluting industries out. I mean, they've moved up the value chain. They're not making they're not having they're making steel. I mean, they used to make a ton of steel. They still make steel. They are probably, but it's much less. They make high tech now, and so they don't create air pollution there. The cars are electric, so many of them. I personally drive an electric car because I really like the instant torque. I will be honest. But the air pollution
it's not what you think. It's not what you think. No, why do we get this? Because it goes fast.
Yes.
Right now.
Yes.
And you're right. Yeah, it's got this significant direct drive turntables inside the electric cars, and they are quite responsive.
Yeah, but it did really help with air pollution.
I remember the first time I was in a buddy of mine's Tesla. That was the thing that he needed to show me. Never mind the dashboard technology. Never mind any of the other stuff. He says, watch this. And he made sure that my seat belts were on, and he pressed the gas pedal all the way down, and the car went from 0 to 60 in right now.
Yeah, 4 seconds.
You feel it.
Because I'm in the Tesla Club Guam.
Oh, really?
Yes.
You're the guy.
I'm coming out as a Tesla owner.
There's nothing wrong with that.
No, it's a great car.
So we and I'm glad that we've kind of edged our way into the conversation about technology because as you said, one of the cool things about being the intensivist, whatever the title is, somebody that works in the ICUs, you're surrounded by technology, and my guess is that like artificial intelligence, that technology is changing rather rapidly as we learn and know more about the body.
Yeah. I mean, that's amazing to live through. I hope it goes well in the end, this revolution. It's very, very, very impressive what AI can already do. Medicine is always very conservative and lags way behind, so we are not implementing it as much in our, ventilators and our ultrasound devices as we could. Technologically, we could do a lot more. But what is definitely changing medicine already is the ability to use basically ChatGPT, but an MD version of ChatGPT called Open Evidence. I don't think there are many doctors who are not using it. There may be some who don't admit to, but everybody uses it. So it's basically ChatGPT, but at a higher level, gives you all the sources and guidelines. It's you know a little better where it's coming from. It's not hallucinating as much. So it's extremely powerful, and I think it can easily replace many doctors.
So it can replace many doctors.
The doctors aren't jumping on it right away.
So to with all due respect to every doctor I know, I've been able to take advantage of digital technology being what it is. I've got access to all of my medical records going back for the last 10 years, and I've taken all of that and thrown it at Gemini, which is the Google version of AI, and now it exists in a conversation kind of zone.
So that is context.
And so as new things pop up, or as if I get another question about something, I can ask, based on the results that you have, what's the likelihood that this is going to happen? What's the likelihood of this? Are we seeing improvements over the years, or since my diet started, or since my new exercise regime has started? Are we seeing improvements here? And the AI will come back rapidly with some kind of a response. It's always got the disclaimer at the end, but there is some kind of a response. And if it's something that's easy to understand, great. But if it's something that's tough to understand, I can ask another question, or I can ask the AI to tell me what questions I should be asking my MD.
Yes.
So it's very empowering.
Powerful. Yeah. I think especially for a place like Guam, and I practiced in Maine for 4 years, so that's very remote, just not as remote as here, but they don't have all the specialists. People are driving 3 hours to see a pulmonologist sometimes. At least you don't have to drive 3 hours in Guam.
No. But, plenty of parking at GRMC.
Yes. But yes, for all of those patients who don't have easy access, and of course in developing countries it's even more, but anyone who doesn't have a specialist, within reach, for them, I think this is great. This can offer a lot of benefit. Of course, there are always risks with every technological revolution. There's risk, and people can get wrong information. But it's much better than what you get.
But the risk
on Facebook.
reward is the risk reward proposition is getting better. I think favoring the reward side. And again, if for no other reason, throw everything into a Chat GPT or a Grok or a Gemini, and then, like I said, you're empowered. You've got data that will back up any suspicions that you might have, or it will help you drive a better conversation with your MD, which is the most important thing in the world. You got to be able to have frank conversations as you get to be a certain age, and all of a sudden everything is the check engine light that's going off on your body, and it's important to be able to have a lucid conversation with a doctor on how to get it done. In a couple of minutes, we'll go back over the dates and the times for the Breathe Easy get together we're going to have over at the Micronesia Mall, because I think it's important. But more important is if there's somebody that's listening right now that is questioning maybe some symptoms that they've got, what advice can you give somebody that maybe is concerned they're not breathing as well as they used to for whatever reason? Something happened. Did you wake up wrong this morning? Or what's the deal? Did you get inside of a cloud of COVID-19 or I opened a bottle of Clorox at the house and I took a whiff of that. All right. What do I know? What do you want people to do? I know you don't want people to wait on symptoms.
Yeah.
Number one, but
I think if you have a good, if you have a good relationship with your primary care doctor and can get seen, that's always the place to start. I would never say, come see your pulmonologist. We just don't have the manpower. I think it's always good to start with your primary care doctor, and then, we will happily see the patient, anyone who's referred, and we will usually start, if depending on the symptoms, depending on how concerning, we would start with PFTs because that's simple, safe, and easy to do. You see the lung function, and then you can sometimes already reassure people. Then, of course, if there are risk factors, if we get particular ideas about what might be going on, we may go straight to a CAT scan. Sometimes maybe an X-ray, but the truth is we very often go to the CAT scan these days.
Well,
it's so much better.
The resolution.
It shows you everything.
When you guys over at GRMC have got multiple slices on that. It's sweet stuff.
It's a good
9:47 in the morning. Eric Plinsky wanting to sell more tickets, even though it's free to the Every Breath Counts at the Micronesia Mall. You said the 20th.
The 20th, Saturday the 20th, and 10 a.m. till 12 noon. Beyond getting all this free information about breathing and every breath you take,
That's his old song.
Who's
from
that?
The Police,
Sponsored by Sting. This one's Every Breath Counts. Okay, we didn't trademark infringe on anything there, but it's going to be a lot of other things too. We're going to have prizes, a lot of giveaways. We're going to have free vital, blood sugar. The diagnostics that we always do, it's like a regular health fair in addition to getting a chance to learn about pulmonology and breathing, how to take care of yourself better. And we have a lot of sponsors there that will be also giving away prizes.
You can name them. It's okay. They're all my friends.
Well, I know Philippine Airlines is there. I don't know. Are we getting airline tickets? That one I can't confirm that. But I don't have the list of all the current people that are already. Some are actually still signing up to participate.
It's important that we single out Philippine Airlines. That's my go-to airlines for back and forth between the Philippines. But they also work with many insurance companies, Take Care included. They've got a deal where if you get the referral and part of the airfare can get taken care of by these guys.
Yeah, they've been a great partner and Micro Mall as well. I mean, a great partner. We do everything there. And all our events. It's just a great, convenient place to do it. But Philippine Airlines has been coming to the table all the time, helping with these flights. And I don't even think it's just to Manila. It's like they'll let you go anywhere.
Oh, bro! And they've got some new airplanes coming out. They ordered a bunch of wider body Airbuses. Right. That are going to be shuttling everybody over. And they're adding flights between Manila and San Francisco. So if you're going to be going on some kind of a medical referral, if you need to go even further than that, these are the guys to talk to.
I think we're going to have $100 gift certificates maybe to Ross, to Macy's, places like that. Now, I wanted to get a little teaser with the conversation we're having. AI and how we're in the in fact, I'm going to a meeting right from here that's in AI Explore. It's with a company in Korea that we're looking at partnering in technology that would allow us to provide patients if they wanted to get involved, and we're looking to see if this will work with our technology at the hospital and the technology they bring. It's really throughout Korea, a lot of the hospitals throughout Korea, and it takes genetic, lifestyle, diagnostics, and medical history, and it analyzes using AI, and it comes up with risk scores. Risk scores for about 72 different diseases that you might be susceptible to based on your results. So it's a predictive analytics, and then it gives recommendations. You can keep updating it with more diagnostics, and it can keep telling you, where you're at in those risk profiles. So it's something we'll maybe be bringing to your
opposite number at Medical City is talking about digital twins. Is that too far off from the platform that you're talking about?
I don't even know what's a digital. That's not where we program like
basically the same
thing. You can have a baby and we can.
Don't we take everything that we know about you? We'll go back to all of the every doctor visit that you had. Yes, not necessarily a clone, but a digital twin. And it's a virtual version of yourself. And so, based on what we know about you and your tests, what you might be susceptible for, what you might have already have, it can help guide some of the treatment down the road. And say, okay, well, we're going to prescribe this for that. And you go, well, based on this patient's medical history, that may or may not work based on what we see in the blood test that we've recently done. So that's an area that they're going down with the digital technology. As I said, I had the spot mass, and that looks for, in the one that I took, it was 10 different cancers that leave traces of the cancerous DNA behind in your body. So they scan using AI and other technology. They scan for that for the cancerous DNA, and if they find them, okay, we've got a marker here, maybe for pancreatic cancer, maybe for lung cancer, breast cancer, and those kinds of very, very cool technology that they have. And of course, the pill that you had me take last year that changed my life is the first thing. The first scan that it goes through is AI before that gets to the doctor.
Right.
So there's so many different places where we're going to be punching in and out. 9:51, and it's always in my mind a challenge to see if I can use the entire hour with Medical City when I go on, because the conversation is always so interesting to me, regardless of the specialty. But you guys just got another award for stroke excellence, right?
Yes, I think it was the gold. We get so many. There's platinums, gold, silvers. We're winning them all the time. But the goal is progression. We keep increasing our scores, and I think it's a valid determination that GRMC is a great hospital. But it's not us tooting our own horn. These are highly credible third parties that evaluate what we're doing and show the progression, and that's why we're Joint Commission certified advanced primary stroke center. It's because of those third parties that are actually evaluating us.
And the other thing is, I don't want to claim that it's any kind of low-hanging fruit, but it has got to be one of the biggest things that we've got here on Guam that claims lives and changes lives in town. Heart issues, lung issues, stroke issues that we have, and it's nice to know that there's some place that you can go, and every second counts. And I'm glad to know that GRMC literally right around the corner, especially given my recent diagnosis. At any rate, but the question that I wanted to leap from there is if there is a stroke, what are the pressures then that can be discovered in one of your patients, pulmonary issues that may arise out of a stroke from a stroke victim?
Pressures, you mean? Do you think that related conditions with a stroke?
Yeah, I got a stroke. Will it affect my breathing?
Yeah.
Because depending on the nature of the stroke, there's impacts to virtually every organ in the body. Even ability to speak and use your tongue and swallow.
Though thankfully, we are very well designed as organisms, and the breathing is extremely well protected. So unless you're very, very unfortunate, the stroke will not. Very unfortunate, you're not going to be affected. Your breathing. Of course, if somebody has a stroke, they'll always get imaging. They'll end up seeing their lungs. It's not rare that we find something in their lungs, even when they scan them only to the neck.
Right,
you can find things.
Yeah, that's my next project. I want to see if I can CT from the neck all the way up and see if there's any other calcium deposits or any other buildup that I've got in there. But is there still the iron lungs? Do we still use that kind of technology?
Fascinating topic. There's still Cuirass ventilators. So the concept basically negative pressure ventilation. Positive pressure ventilation, you put a breathing tube, you inflate the person, right? Or you put something around them and pull them apart, and then you have negative pressure ventilation. That's what the iron lung was. You put the patient into a negative pressure and just put them, seal them, their neck.
At the neck,
and that worked really well. It's not widely used. I think there's still maybe the military is still trying to use that in some way. It would be nice to just attach something here and pull open your chest, right?
And use the vacuum then to draw in
negative pressure
the air.
ventilation. Yeah.
Wow.
It sounds really good, but no, it's not widely used.
All right. One last fascinating question for you. What did we learn from COVID?
Oh, so easy.
Did I need to start that at the beginning of the show?
I think we're still learning about it. There's a great book called The Great Pandemic about the influenza pandemic over 100 years ago.
Yeah.
We're still learning. We can learn a lot from that. I think this is a really hard question. What we've learned, I
never got the vaccine.
Yeah,
I was a COVID denier. I recognize that there are people that died from an illness that affected their respiratory capabilities, and there was a whole lot of panic and knee jerk that took place. And I found shutting down the worldwide economy was probably not the wisest thing to do.
Yeah. Oh, there's a lot to learn. I think specifically about the vaccine, I think it's very interesting what we've learned about society from that. I was at the opposite end of the spectrum. I was part of the AstraZeneca trial, also partly for selfish reasons because I was scared and I wanted to get a vaccine. Because I was working in the ICU in New York City. So I got in December 2020, I got the first shot. But over the years, like working in New York, in Maine, I've really realized that the big problem is, the trust, right? If you don't have trust between people, like not just doctors and patients, but in society, then you're not well equipped to handle a pandemic, and won't be able to handle the next one. And I think one nice thing about Guam is that we still have a bit of more tighter community. It's like the opposite end from New York City. It's one of the reasons we moved here with my kids, and my wife. I think there's still a lot to learn. I think a lot of people need to get humble, right? Doctors, politicians need to start. Both ends have really overdone it, right? The anti-vaccine drive is insane. And to the people who shut down everything, who like pour sand into like skate parks in France and like in California, those people are also idiots, right? Like, so like we can all agree that there's extremes that are probably bad. And if you don't gain a trust, if you can't get people to believe you, then you're not going to succeed as a society.
Said, in the next one, it will be harder to do because I think of a big chunk of that trust that you say.
It's hard work. We just have to build it up slowly. It's very easy to tear down a shed, right? It's very hard to build it up. So that's what we're going to try to do. We're just going to try to convince people, and it's not by like, you need to do this, you need to do that. And that's why I've shared that I, smoke marijuana like back in the days.
Well, you got credibility. You and I are sitting at the same side of the table on a lot of these topics here. So I think that helps. I
may not be as knowledgeable as everybody else, but I will say one last thing if you have time for that.
We got a couple of minutes,
Okay, because I really wanted to get that across. What I have noticed, and I had that at Amherst Hospital very much too, so I'm very used to that. Tuberculosis is very common, right? People know this. And I think that's an underappreciated public health problem. People don't like to talk about infectious diseases. There's a little bit of stigma still with it somehow. And I will say that I came to America and got, tested. Like every immigrant basically has to get a test.
TB test.
Was negative, and then converted and got TB in New York. So I will publicly announce that I had TB. And it's very easy to test, right? It's just a blood test. It's covered by Medicare. Primary care doctor can do it. We don't have to come to GRMC for that even. It's very easy to do. And if you have it, you take 3 months of, medication, which don't have many side effects. I had to take it for 9 months, and they told me I can't drink alcohol. And I can tell you can still drink alcohol. You just can't drink a lot.
He's from Germany.
Yes, I would.
Who's this guy? Except that he's got a haircut like Joe's, we could be brothers. We absolutely could. I'm so glad that you came by this morning, and I'm glad that we've opened up as much as we possibly have. I think that you are sitting in the same time. I think there's a lot of us sitting on the same side of the medical picnic table right now, and it would not surprise me if you made it that much easier for people to want to come and visit with you and maybe go see their doctor about maybe a little something going on and maybe a cough they've had for a little bit too long or something like that, and maybe get into go and see you. Get a head start, 20th, Micronesia Mall, 10 until noon. Is that right?
Yeah, that's right. Saturday the 20th of September, Micro Mall, just a nook off of the center court. Where the old JP Superstore was, across from ePro. So we'll see you there. And thanks, Ray, for having us again.
No problem. I tell you what, maybe in between now and then, or in between now and the next visit, I'll go and have a chance to do the PFT.
That's right.
For Real Joe and Donna D, happy birthday, Donna D. This is Ray Gibson saying thanks so much for listening.